Singapore's new healthcare reform plan has been endorsed by Parliament as Health Minister Ong Ye Kung calls on all stakeholders to push for a healthier lifestyle in a rapidly aging society. In closing remarks after a two-day debate involving more than 30 members of Parliament, Mr. Ong also addressed various concerns and outlined the next steps for the preventive care strategy. Sherlyn Sia with more.
A key effort to transform Singapore's healthcare system as the country strives to be healthier. In his rallying call, Health Minister Ong Ye Kung says the old will outnumber the young in just 8 years' time. But he adds that Singapore has the resources and ability to confront population ageing.
It is an urgent and stern test, and some societies end up with bankrupted healthcare system or let healthcare cripple their society and economy. We are determined to overcome this test.
Healthier SG aims to foster long-lasting relations between residents and their selected family doctor, who will support their health needs throughout their lives. In light of some MPs' concerns of an increased workload for clinics, Mr. Ong says efforts are underway to boost manpower. The Health Ministry will increase the number of family physicians to 3,500 by 2030 and also enhance the larger health ecosystem.
The key challenge is to have sufficient nurses, allied health professionals, support care staff to operate hospitals, clinics, also elder care centres. These few groups number about 58,000 now, and MOH estimates that this will need to grow to 82,000 in 2030.
That's especially important as Singapore seeks to strengthen the synergy of its three health systems. These are acute care, public health, and in particular aged care, which will be the next major area of reform that Singapore has to work on.
Today, 97% of our seniors above 65, they can either live independently or with some help in the community. We must maintain or improve that share. For the large majority of seniors, what they need most is social care, more than healthcare. And the way to deliver that is to enable aging in communities. This includes building more community care apartments and releasing land for private assisted living facilities.
The Health Minister also addressed the role of traditional Chinese medicine after several MPs raised points on how it could be of value in preventive care. He says he believes TCM can play a role in Healthier SG, given that both Western medicine and TCM look at the early management of risk factors to stave off problems later in life. While the ministry works out further how TCM can better complement Healthier SG, Mr. Ong calls on TCM practitioners to continue taking care of the patient's health holistically.
The Health Minister also addressed clarifications on key performance indicators under Healthier SG. Mr. Ong says that while general targets will be set, doctors will not be penalised for not meeting them. He says that the billion-dollar setup and 400 million yearly recurrent cost is money well spent to keep the population healthy. He was responding to a query by non-constituency MP Hazel Phua.
When he said that there will be no KPI for family doctors and no clawback, does that mean that we will be paying this $400 million a year with no accountability?
400 million is first to subsidize residents for health screening, health points and all that. The other half is a service fee to GPs to help us take care of population. And I think she just made a statement to say this is not a good spend of money. And if you want it to be spent well, give KPIs and targets to the GPs, and if they do not meet, claw back the fees. This is not what we should do in a major effort like this. Of course, there will be KPIs with targets. At the GP level, they will have certain targets as well, but I do not think we want to treat them like vendors and contractors where if you missed out on certain KPI, we claw back the fee. They care about the health of the population as much as we do.
Some 400 general practitioner partners have been trained to care for persons with mental health conditions in the community. And the Health Ministry has been working closely with stakeholders. Senior Minister of State for Health, Janil Puthucheary, says an interagency task force on mental health and well-being completed its public consultation in August. It will share findings soon. He was responding to several MPs who asked how Healthier SG would support mental well-being.
Could we consider improving access to mental health care support to all Singaporeans by increasing the current psychiatrist to population ratio to 10 per 100,000 residents, similar to other countries such as the United States and Australia? We should also encourage Singaporeans to have a dedicated counsellor or psychologist, similar to how we are encouraging everyone to have a regular family doctor, to serve as their first point of contact for their mental health.
Good health is also about good mental health. The current planned interventions under the first phase of Healthier SG will support mental well-being. People have asked, when will we start to look at mental well-being? Yesterday, actually years ago. The interventions we already plan under Healthier SG, starting with our initial emphasis on eating well and regular exercise, will have a positive effect on mental health.
8 in 10 seniors will be able to access activities and programs at elder care centres near their homes when the number of these centres is doubled to 220 by the year 2025. Second Minister for Health, Masagos Zulkifli, says that efforts like this, together with Healthier SG's emphasis on preventive care, will provide a strong foundation for seniors to age in the community. He was responding to concerns by MPs on engaging seniors in the healthcare reform plan.
With more understanding of how senior daycare centre works, the lower costs involved, I believe more families will be willing to have their loved ones in daycare rather than nursing homes, when they're still able to handle. We need to get our GPs to come on board to be a coordinator of care for these elderlies and the primary care networks under Healthier SG to play a bigger role in our elder centres.
Another concern is regarding the use of Health Hub to those preferred clinics and enroll in Healthier SG. Will assisted support on site and various helplines be available at the clinic itself or at CCs? As many seniors are non-IT savvy and some may be illiterate, they will not be able to use the apps after enrollment to monitor their health progress.
Elder care centres will be further strengthened as the keynote for seniors. ECs will be the go-to points for all seniors' health social needs, including connecting them to social and lifestyle activities and monitoring simple vitals. Welcome more stakeholders and community partners to come together in this endeavour to build a society that empowers seniors to contribute, be socially engaged, and achieve their aspirations.
Meanwhile, Senior Parliamentary Secretary for Health, Rahayu Mazam, is calling on individuals and organisations to come up with programs that can supplement the government's existing health promotion efforts. She was responding to suggestions from MPs for a wider variety of community programs to cater to different needs. She adds the government will continue to explore how it can collaborate with the private sector under Healthier SG.
It would be better to see more engagement with private sector entities that provide relevant and structured programs. Some of these programs are customized to the requirements of our seniors and persons with chronic diseases. Partnering such private sector entities would give Sports SG and PA greater options and relevant programs to communities that require specialized programming.
We do want a vibrant and robust slate of programs, but not all programs need to be HPB or MOH-driven programs. To optimize resources, we will have to channel resources towards programs that are well received and impactful. However, we encourage community partners to play a part in this.